This is the unit I was talking about. The FDA has approved that we can actually use this one through the brain for anxiety, depression, and insomnia. Now for sleeping, you need to start using it on a daily basis. They just 20 minutes at a time is all you need. And it's not like you have to lay down with it on or do it just before bed or just at a certain time. Any time during the day for the 20 minutes is enough to use. You get your full effect after actually 6 weeks. So we'll have it on a month rental for you to see how you're doing with it. And if it's working out well, we'll go ahead and bill your insurance then for you. So this actually changes the waves of your brain. When somebody has irritability in the body, if it's arthritis, if you're having a headache, any dysfunction that's going on in the body actually has spikes in the brain. So normally the brain wave is kind of nice and smooth and kind of like a rolling of the ocean coming in. Now when you have a problem, the body picks it up in that area of the brain by heavy spikes. So what this does, it puts back the normal current and smooths everything out again. So the idea behind this is putting a biological current back in. This is, everybody knows what a TENS unit is. Your friends have it or somebody else relative, or if you've heard about it. And the TENS unit actually is 1,000 times stronger than this. And what the TENS unit does, it irritates the skin, so it kind of distracts you to decrease the amount that is going through your pain fibers. So if you have a mosquito bite, and what you're doing, you scratch around it so you get the itch to go down. You're stimulating the skin nerves, which are a lot larger than the small pain fibers that actually is part of the itch. So you're overriding it, kind of like when you have a bruise and your big toe is hurting on one leg and they say, well, I'm going to take a hammer and hit it on the other and it'll go away. Well, that's kind of how a TENS works. It's a gate theory. Why this actually does healing purposes. It's more medical. It has a pulse width that is 100 times wider than a TENS unit. And the reason it does that, it has multiple frequencies. So in your cells, they have little receptors. The different frequencies get these cells to start working again. So it's actually putting back a biological current through the brain and in areas that we need to work on directly to that area. Okay? So the Alpha Stim has been around probably 15 to 20 years. It helps so much that a lot of times people don't want to hear it if they're making a whole lot of money from giving injections. I went down to a pain clinic and I worked with their people in their waiting room, the doctor let me. And half of them were saying, I feel better than this than the last injections that I got. So the idea about everything is going pharmaceutical. It's much easier to take a pill. And the reasoning behind our society of the medical program is just that they don't want to hear it. If you can take away anxiety, depression, and insomnia just with this one unit, the amount that the pharmaceuticals would lose is enormous. And nobody wants to hear that. So this is pushed always on the back burner. And in fact, they still got this under experimental after 20 years. And they had to fight the FDA to get any approval at all with it, because it actually works, and it's very hard for them to prove that it doesn't. So the type that we're going to use because of your neck pain that you're having, this is a little different unit. This is the one that we put through the brain using the ear clips. This actually just has felt probes, and we're going to go ahead and go through the areas and take the pain down with it. Now it takes it down within an 8 seconds per area, so we're not going to be keeping it on for a very long time in the different places. So I got it turned on, we got it set, and now what's going to happen is it'll beep and tell us when we need to move. And we go through 2 beeps on every area. So I'm going to open up the pathways above and below the area, so we're going to go from the head back to the shoulder here. So we're making big X's through the area that we want treated. So we'll wait for 2 clicks, we'll go on to the next one. And the little dampness that you feel on the electrodes is just a saline solution, so it makes contact. occasionally, the only side effect that some people will complain of is only while we're doing it. If it would be up way too high, you actually have it to where it goes through the limbic system, and you'll feel a little dizziness with it. All we got to do is turn it down. It's still working, and you won't have any side effect. Okay, then we're going to go a little bit smaller X's through the neck area. The one good thing that is shown with this, it also will help an open wound. Now, if there's not enough circulation, like somebody has peripheral neuropathy, where the nerves at the end that are in the feet start dying, and that happens with people around 70, that people that are diabetic, it can happen to somebody that has been an alcoholic, on drugs, or just hereditary. That peripheral neuropathy, the nerve dying, we put these with pads on the ends of their feet to run it all the way up through their leg from one foot through the other one. And within 4 treatments, they can start feeling again. So if they're having a lot of burning pain that's going on, that will be diminished within 4 treatments. And that's actually healing the nerve. We're not covering anything up with that. Also, people that have a severe cut, by putting the pads across the wound, you don't have to put it on top, it actually adds to the healing process by the energy packets in the cell it produces. So it not only helps with the endorphins to take down your pain, it produces the energy packets in the cells themselves for healing, and by running it through the brain, it puts back the normal biological current for anxiety, depression, insomnia. Okay?